YouTube comments from a video titled, Medical System is About to Collapse. How to Save Yourself. Part 6.
The Sarah Allen H5U wrote,
I don't feel sorry for doctors or nurses. Why did you push opiates? Why do you never talk about nutrition? Why do you push statins? Why did you push the C-19 agenda? Masks, jabs, social distancing, lockdowns, dancing nurses? Why do you allow autism to destroy more and more people's lives and do nothing? 2020, when our loved ones needed us there at hospitals, nursing homes and doctors' visits. You denied them. People died alone. Or they were harmed. They had no advocate. Our family was directly harmed by this. Go to hell. How about children and lockdowns? How about the opiate epidemic? Why don't doctors and nurses stand by their code of ethics? Why don't they take a stand against insurance and big pharma? The truth is, doctors and nurses are greedy. They don't care about helping people. They care about money. They get no sympathy or respect from me or my family, and I know so many people who've had it. Go ahead and quit. We will be better off.
A Brew Clown wrote,
I'm an RN and write blogs for the wellness company. They have memberships that include unlimited prescriptions and unlimited telehealth visits equal all included for $99/month. You can usually get a visit same day or by next day. I use it and have found it to be an extremely valuable service.
A Don Merrick 7001 wrote,
For those who think healthcare is a right, who will you enslave that has the ability, interests, and desire to become a doctor and work for peanuts? There are some good people out there, but private equity has ruined healthcare. ACA and government interference has ruined healthcare. Rent-seeking by insurance companies has ruined healthcare. Also, most Americans refuse to eat right and do some minimal level of exercise that I cheer RFK trying to make the food companies change their ingredients and reviewing this retarded nonsense that all vaccines are great and safe and at least take a look at facts.
A Gerloff Nikki wrote,
A friend needed a complicated birth 30 years ago. She needed a C-section. Her health insurance refused to pay for her epidural anesthesia. $1,200, which was an enormous amount at that time.
At Miriam Jewett 5438 wrote,
The Affordable Care Act is what we are experiencing. It does have nothing to do with healthcare. It has everything to do with control of humanity and dumbing down our medical professionals. I say good riddance. There is a better system coming.
At Harvey wrote,
I suspect the biggest problems with health in the U.S. is the attitude that has somehow been instilled. Not that many years ago my cholesterol was starting to get high. I figured, no big deal, I can just take a statin. Thanks to all insanity that went on during the pandemic, that attitude changed. Now under control naturally. I'm also lucky in that my doctor doesn't want to prescribe a pill that I have to take the rest of my life. Once you put a middleman, insurance companies in this case, into the process, things go to pot. That Medicare wellness stuff is total BS. It's just the way to add more bureaucracy into Medicare system to justify themselves. I'm old enough to remember a time before dental insurance. Once that became a thing, I noticed fees for various services more than quadrupled. I've often wondered how much of the price increase goes to the insurance middleman and simply having to pay the dentist more, which, considering the added paperwork, I don't blame them for charging more.
At Binky the Elf 1 wrote,
Canada has the worst wait times in the G7. I know someone who waited 18 months to see a specialist. The specialist confirmed that back surgery was needed for a very painful problem. That was 3 months ago, No surgery date yet, and you can't ask the system for updates or wait times. 21 months and counting, debilitating back pain continues. Of course, you see and get a fatal needle from your doctor within a week or so.
At Mary Magnuson 5191 wrote,
Under the current system, if you have a bad cold/bronchitis and need an antibiotic and maybe a short dose of prednisone, you need to pay for the doctor visit in order to get the prescription. Then you have to pay for either the whole prescription or a copay depending on what the insurance will approve. The pharmacist is quite capable of assessing your problem and providing the best guess as to which antibiotic you need to try, and if that one does not work, you go back and get a different one. Just like with the doctor without paying for the second visit. It's all bull st. In other countries, common meds are over the counter and cost 1/10 or less of the price in the US, and no doctor visit needed. It's all racketeering.
at Heide Balestein 6459 wrote,
I am absent/RN of 25 plus years, also disillusioned by what I have witnessed. Also worked in hospital IT. The amount of charting Vs. I still work in the industry, but just graduated MSOM Classical Chinese Medicine and Herbology, and bachelor's in nutrition so I can transition out of the industry. I get the cheapest insurance and receive the subsidy since I was working less while in school in case I get hit by a bus. But I am avoiding FT work and doing 1099 instead. I manage my own thyroid via self-pay Quest Labs and see an online provider for the RX. I also self-pay for BioTHRT with testosterone for the severe vasomotor SX, since a traditional provider want RX testosterone and I put this on care credit. Agree the system is broken and collapsing. I worked for a few plastic surgeons and interventional radiologists who own their own surgical suites. I call them all whores. All of them also toxic work environments. At one place where I do PACU, I observed my very first Bovi pad burn. Instead of assessing the pad placement, they just kept changing the Bovi handle. And then the doc came through the PACU and gown and flipped the circuit breaker, but no one assessed the pad. I went into OR and lifted the drape, and the pad was puckered and wet with betadine. He swore it was a pad malfunction. I pushed back that it was a failure of untrained circulator and safety protocol, and he called me later to gaslight me. Further, he excised the burns and sewed them up without consent. At another place owned by an interventional radiologist, I circulated for a CDF case, where I witnessed a surgeon. I know who is the head of Neurospine at State HSP bring workman's comp PT to this facility so they could all split the dollar, essentially diverting funds from the state. They also video and audio tape staff, and I called them out for it. If I had better personal finances and wasn't trying to get through GROD PRGM, I would have been a whistleblower, but I am also a Hashimoto's PT and already just trying to survive. I would never ever have surgery at an outpatient facility based on what I have seen over the last few years.
at Unbreakable 7633 wrote,
Doctors need to realize they are in fact legally fiduciaries to their patients and act like that again. They owe the duties of honesty, loyalty, full disclosure, and not to charge a patient more than that patient can afford. Docs don't think they are fiduciaries any longer, and that would help a lot. But health insurance and government have both wrecked the system too. A society that no longer works for ordinary people isn't worth preserving, and it's a dark future for ordinary people.
at Rose Puerto 8781 wrote,
Excellent discussion. I feel same as you describe, totally untrusting of the current system and where it's heading, and optimistic the pendulum will swing drastically back to decentralized medicine and small local offices. God bless.
Tina Singer Pi 3 LG wrote,
I was in nursing school back in my 20s. That was in the late 90s. And I didn't stay within the system very long because I questioned everything and constantly got told to mind my own business by doctors.
I worked for so I became a federal police officer. The entire time, my entire life. I have been very sick, and once I moved 10 years ago to New York City. Things got progressively worse with my health. This is the worst place to get sick. Nobody cares here. Nobody listens here. They have no answers and don't want to hear what you have to say. A year ago, I was so ill it turned into a MRSA infection and had cardiothoracic surgery. I'm still suffering so many issues and practically homebound. Thankfully, I'm able to walk again, but not well. So I'm telling all of my doctors whose next step after cutting out my thyroid and my gallbladder, now they want to take my uterus. I keep telling them there is something deeper going on. You're not cutting any, or if my body parts out. Those are all necessary. There's an underlying issue that's not being addressed. Or even looked for. All you're doing are CBC in the fact that I don't have a thyroid. The fact of my family history, including my own children and my siblings, all point to Epstein-Barr. But they won't even test me for that. How does that make sense? How does that make sense? I am suffering. I am in miserable pain, difficulty breathing. Boa, constrictor around my chest. I have every single symptom. And when I look at app and I use ChatGPT, it's telling me that, yes, because I grew up in the desert and I was out in the farm and in the sun all the time, that probably laid dormant in me. My sister was an inside kid. I was an outside kid. I moved to New York City 10 years ago and my current apartment has mold. No ventilation. I'm under high amounts of stress because the residents are dangerous criminals that have assaulted me and tried to break into my apartment. I'm isolated. I have no friends or family here. All of these things point exactly to what I'm saying. I feel like my spirit is leaving my body. Through my head, I'm always woozy. I had eye surgery when I was 2. Everything points to Epstein-Barr. My hematologist said I'm not doing any test on you. Until you see another OBGYN. But you already did a uterine biopsy and told me I had non-Hodgkin's lymphoma, which is another symptom of Epstein-Barr. I am so frustrated. I feel like I'm just going in circles, and the more I'm doing my physical therapy and occupational therapy, so that I can hold things in my hand and walk again unassisted, it's exacerbating the issue between my shoulder blades and up alongside my neck. At the base of my skull. Why is no one listening? Because they don't care. They only care about doing surgeries so they can get a bonus check. They only care about giving prescriptions so they can get a bonus check. I'm tired. I'm so sick and tired. What a failure. Nothing has changed since I was in the nursing field. My grandmother was a nurse. My great-grandmother was a medicine healer. This is not working. I'm barely holding on. I'm spending hundreds of dollars that I don't have to spend because I'm on Social Security now for supplements. And I am the only thing they ever keep. Asking as if I'm suicidal. Do you have ideation? If you were in chronic pain and people just kept telling you it could be fibromyalgia, we have no idea what's wrong with you. But I'm in and out of nursing homes. I'm in and out of hospital. What is going on?
Adrianalan 4492 wrote.
I went to one of my local doctors with a very obvious bacterial infection, and I was refused antibiotics. What does that tell you? No cultures done. Nothing. Simple blood work that actually indicated I had a bacterial infection, and I still was not treated properly. But I was charged $450. That says it all. My doctor assumed it was a viral episode, even though I rarely go out and was not exposed to any ill individuals. The doctors are threatened with losing their license if they prescribe antibiotics because of the so-called fear of antibiotic resistance. Granted, in rare cases that occurs, but as a result, they're not treating most patients that need antibiotics, and they are getting seriously ill and or dying as a result in some cases. My doctor said I would be recovered in 3 days. I was still sick 3 weeks later. Do I trust doctors now? No. It's all about the money. My doctor recorded that I was speaking to him for 21 minutes exactly. Sounds like he had a stopwatch going. Next time I go to a doctor's office, I'm going to have my stopwatch going. I was charged for 21 minutes of the doctor's time, and he spent most of that telling me about his family situation. He didn't even record in the chart what I shared with him. What does that tell you? Complete incompetence.
At Fliskook 8934 wrote,
Believe me, I absolutely love your videos, solo and collaborative. My comments here may come across with rather too much edge, but I want to say, I am passionate about justice for all sentient beings on the planet. I am very grateful for what you share here. Your take on the current trajectory of medicine is bang on point. It's terrible for the patients in the UK and US where I have family. I am a fairly intelligent Brit currently living in Hull, UK. I have joined the user group of patients and staff at my med practice to give my voice to how things are run. And I have ADHD recently diagnosed at the age of 72 by a consultant psychiatrist. The convoluted red tape involved in getting the two meds I use is an absolute nightmare. GPs have 10 minutes to see each patient, so they look you up on the computer. WHY isn't there something on the first page of our records to inform the DR immediately of our significant conditions plus current meds? They don't have time to look up these crucial bits of information. So unless the patient is on the ball and able to speak up for themselves, they are at risk of inappropriate and sometimes dangerous practice. I feel that ultimately, the onset of using vibrational medicine and sound will be the way forward, but that won't come in my lifetime, unless of course everything on the planet collapses and new routes need to be rapidly found for those still around. It's less the medics and 80 to 90% big pharma that are to blame. Also, I totally agree. WEDO need to take care of FOUROWN health instead of having people in white coats WHOWEBOTO AS gods. It is so ridiculous and is, in the UK, a learned behavior. I was born around the time the NHS was formed. It is a marvelous animal, BUT. It unintentionally created a society where many people exploited it, as they were subliminally encouraged to do so. And this is where we are now. WE must change. Thank you guys.
At DGH 5223 wrote,
Told my hubby we shouldn't use our insurance unless we were admitted to a hospital. They charged my insurance $10,000 for ER visit, blood work, EKG, ultrasound to check for a problem they thought I was having, but nothing was wrong with me. I still had to pay $2,200 of it. I think hospital don't charge the person as much with no insurance.
Assault with Light wrote,
From Rockefeller dictating an entire medical education system to Ivy League University being paid from Big Pharma and altering results that students years later cannot even duplicate, to other countries being used as lab experiments. USA funding, gain of function. I'm different countries since it became illegal on US soil to vaccines being tested against other vaccines, not placebos. Western medicine isn't trusted anywhere because it's not healthcare, but slavery to a system of drug-pushing, symptom-treating, non-proactive health. The food industry, agriculture, insurance, buildings. It's deeply embedded into the economy. Man's dogma for any field doesn't address the whole person of soul, spirit body we live in. Even functional doctors are stating per spiritual health isn't addressed, which is a greater part of being human. We've left out educating how our body is designed to repair itself. Western medicine is all about anti-drugs. Instead of PR/prebiotics, the extreme Western medicine kills ALL bacteria, including beneficial. People eat antacids instead of building their stomach acid. Wheat is the future in health that keeps people sick by design. Even ex-agents talk about how the world is turning away from Western medicine for peer medicine. Chinese and Ayurvedic medicine was hidden by Rockefeller by design to keep people dependent on Western medicine. Natural remedies were treated like an enemy and suppressed in education. Then FDA became the police, stating if science didn't say something worked, you would lose your license for even speaking about another remedy or medicine. The monopoly mob has been found out. No one trusts Western medicine anymore.
At West 1968 wrote,
It's time to start using natural health alternatives. People didn't live as long when they used this method, but maybe that's the point. I've gone the polypharmacy route. It was horrible. I drink chamomile tea instead of blood pressure meds.
At Johanvan Shockwicz 7634 wrote,
I'm a physical therapist and have had my own private clinic for 23 years. I have seen medical care getting worse and worse the more they have caused private practices to close by cutting our reimbursement by 50 to 60 20 years ago. This made it very hard to survive with all the expenses we have, and that's why so many private medical practices have closed down or have been bought by large corporate medical companies backed by private equity companies. This was a collaboration between health insurance companies and private equity companies to destroy private practice so they could keep all the money. Now the insurance companies invest in the private equity companies and reimburse the large corporate-owned healthcare companies double to triple what they paid the private practice. The insurance companies not only get the premiums but also a percentage of the reimbursement they pay to the medical facility. It's a disgrace and should be against the law. They are destroying healthcare in the U.S., as people have witnessed with declining care.
and Mrs. Stocky 2445 wrote,
My friend is a pharmacist for Vanderbilt and has had his cancer treatment claims through Vanderbilt denied by the insurance company that provides insurance for the employees of Vanderbilt because it was deemed not medically necessary. Make it make sense.
At Robindimond wrote,
I agree with a lot of the comments and what is being said. However, my life was saved by the emergency room doctors. I guess I can't complain much. I do thank God for their skill and the new technology available to them. Without it, I would be dead. I just wanted to give a kudos to the hospital and neurologist. There are some positive aspects.
At Curtis Hawkins 6838 wrote,
I'm a retired dermatologist. I used to refer patients with melanomas to a plastic surgeon for excision. I would receive a letter from the surgeon stating that the melanoma had been excised. After the surgeon adopted electronic records, I would receive 6 to 10 pages telling me that the patient lived in a house with stairs, had received a flu shot, a pneumonia vaccine, etc. There would be 2 lines telling me that the melanoma had been excised. Hospital electronic records were worse.
At Sherwood 5427 wrote,
I knew something detrimental to healthcare was going on 40 years ago when I started seeing private practices becoming integrated into one of a few major hospital systems.
At Delna Carruthers 7277 wrote,
My husband has been suffering from a stiffening of the neck. His DR sent him to an X-ray. He said he had to have that before he could order MRI or CAT scan. The first test came with out-of-pocket $450. What a scam.
At Artist Kevin Bethel wrote,
When the assassins of technology and bureaucracy were invited into the exam rooms, medical care was pushed aside. You felt it first, before the doctors and healthcare providers even looked up from their screens. When a few brave people sounded an alarm, it was the very people who were supposed to protect and care for your health who drew their knives to enforce the cold spiral of decline they called the new normal.
Carrie Zing wrote,
I've had ME for decades and resistance training in the gym once a week plus a few minutes of walking every day is my limit. It's so frustrating, especially since people don't believe me.
Isamor wrote.
I am a retired physician. Medical care is not synonymous with healthcare. With respect to chronic diseases, medical care is only a small part of healthcare. The American public have been deluded by the pharmacomedical complex to think medical care is healthcare, and many hospitals are rebranding themselves as healthcare systems.
At Robbie Anderson 5730 wrote.
I am a retired teacher. I saw the same thing happen with education. Mandated testing from Texas government was one of the root causes. No solution, just get out of public schools.
At Dunning 6207 wrote.
I've never had a DR heal any one of my reasons for seeing the DR. I've always had to go home and research. For at least the last 30 years. So, I am not on ANY prescriptions.
At Rapiers 7004 wrote.
These docs need to contact RFK Jr. and give their stories of this coming medical crisis, HHS. These insurance companies and pharmaceutical companies need to have the brakes out on them. Hospitals should not be able to bully individual doctors and force them out of their practices.
At Rubixfinity 8634 wrote.
The AC subsidies need to go away so that people experience what a total disaster that it is. We need to go back to the competition-based insurance model, major medical coverage primarily, with reasonable deductions under $5,000. For pre-existing conditions, when you switch providers for better deals, that should be covered separately by Medicaid so that it doesn't overburden the insurance pool. The insurance companies that offer the best deals will make the most money, and doctors will start getting paid fairly again. We've lost so many great doctors because they can't deal with ACA and the way it tells them to not provide healthcare to people. My doctor explained that ACA requires him to spend no more than 6 minutes per patient total in order to earn a profit and pay the bills for his practice. And of those 6 minutes, he needs time to review all those records and also enter additional records about the visit. So when you're frustrated that your doctor only spent a minute with you, thank Obamacare/ECA. That's HOWITIS designed. It needs to be scrapped. It is a total failure.
At Sherry Ditzler 7908 wrote.
Great advice. Thank you for all you do to help us who want to take the reins for our health and those we love with a love care concern and initiative to get the best possible care. I personally pray for guidance. This has greatly helped me over the course of many years.
At Wax Goddess wrote.
Insane seeing doctor after doctor after doctor and getting blown off every time. Doctors don't believe my symptoms. My labs are fine or telling me that I look good. I've completely lost faith in doctors.
At Carol Thompson 2727 wrote.
I can't even get my doctors to really listen to me when I tell them what is going on with me. I've even given them the research I've gotten with the possibilities of what it could be. All they have to do is do the necessary tests, blood work, and procedures to find out for sure. They won't listen. They want to assume things without any type of test and want to give me medicine for what they might think it is. They are not finding a source. I know my body. It's all just crazy now.
At Carl Harmeling 512 wrote.
I'm at 617, and there is a complete lack of empirical examples of their complaints. Just a lot of job boning about insurance companies denying services without any citations of just what is being denied. There are too many bogus procedures that are unnecessary and even harmful. The medical industry is full of it. Who decides what is and what is not good medical care? That's between the DR and the patient. If the patient is responsible for the bill, a lot of unnecessary things will be avoided.
At Keith Wilson 9116 wrote.
No one forced docs to sell their practice. They chose to sell for the big bucks.
Insurance companies should not be allowed to own a medical practice. It's an obvious conflict of interest. No one should choose to enroll in a managed care plan. Management comes from the insurance, and they are financially incentivized to deny care. Take charge of your own health and exercise self-discipline.
Cab 520 wrote,
Stop educating people to be financial doctors and treating with drugs rather than fundamental medicine. Educated by pharmaceutical money to use chemicals and not look to cause and cure or treat with appropriate care.
At Livin' Life with FND wrote,
I almost died in 2023. I had a stroke/paralysis due to psych meds. They continued issuing the drug. I refused to offer me mental health services, but then issued me with a outdated diagnoses, which was getting me rejected for more rehab. They refused to give me a arm sling for subluxed shoulder, hand splint for contractures. I was on max dose of muscle relaxers, melatonin, doxepin, zipridone, and ibuprofen, and they gave me something via IV that I never consulted, and she only confirmed by phone that it was for me. I quested it because I never consulted about it with her. They just told my POA I was high or having anxiety attack. But I was having seizures. Well, my insurance was ruining out. I lost my career, can't drive, lost my home, and still couldn't walk/stand for prolonged periods or distances. Then was sent to a homeless shelter. However, the PCP sent me back to the psych hospital. I lost all progress. They again refused to look at my history. Still treating my complex case over the telehealth, gaslit, abused, neglected, and gave me new meds or unrecorded. And they gave me seizure meds to suppress my appetite. Well, this caused seizures. They refused to send me to the ER, forced me to ambulate at a surprise discharge, but that caused seizures with vomiting. Then they were going to try and kidnap me, stating they accidentally discharged me, but I can go back to the homeless shelter or stay another night until they figure out what to do with me. I went to the homeless shelter and went right back to the ER, which I do not trust anyone in healthcare anymore. Every time I go to the doctors, I have anxiety, seizures, syncope, and blackouts. End up in the ER until I tell them no ambulance and refuse ER trips. But lol, what makes it worse? Also, FND patients are now getting mistreatment, gaslit, abused, and neglected more. I feel like I was misdiagnosed and really have protracted withdrawal. FND is pretty rare. So I was diagnosed with this and get mistreated in healthcare all the time. Then my dad was diagnosed with Parkinson's because his elderly age and senile tremors. No labs, no test. And he gets treated much better with Parkinson than me with FND. He finally gets lab work and B12 shots with no problems and finds he is also B12 defiant. Me and FND, it's hoops and hurdles. They don't do that lab work and don't offer B12 injections. LOL, it's a joke.
At Suzable 5320 wrote,
Here in UK, we have Dr. Sarah Mihill. All her info is free on her website, or on YouTube and in her books. Thanks, Dr. Dond, your cardiologist, and Ben.
Cass Augustine wrote,
September 10th, 2025, I received a letter, as did 100 other patients, from the primary care doctor that I have been going to for 10 years. This practice had been open nearly 45 years, including doctors who retired. One employee is 75. She has worked there for 35 years. THE letter stated that THE office HOD closed. WE would have TO find NEWPCP ASAP. WEH 82 half weeks TO order OUR medical records from an independent company. Please, beware, this could happen to you. Many people are on medications that could be harmful. If you go cold turkey, have to go off without warning. Look for backup doctor that you could easily transfer to another doctor should this happen to you. It will save you much stress and disruption.
Gail Copeland 9707 wrote,
I don't have a doctor right now. She left the area. Her replacement, who supposedly came on board October 1st, hasn't started taking appointments yet. I am looking for a doctor, but the next appointment I can get is summer/fall 2026. I've taken my annual vaccines and try to eat right, exercise and take my DR recommended supplements and plan to go to an urgent care clinic if I get sick.
A serotonin wrote,
Retired RN here. I absolutely agree with the other healthcare professionals here. The system is broken. I said decades ago that with insurance companies dictating care, time spent with patients, and ridiculous hoops to jump through, that patients will certainly suffer.
A Spiritoff Mongan wrote,
I'm 71 and live in Central Florida. I cannot find a primary doctor that will treat me as an individual rather than one of the herd. Once you get into Medicare, the quality of doctors decline.
A Sandra Morton 5510 wrote,
What are doctors doing about it? No disrespect. When things need to change, it is up to the people on the ground. I had to use YouTube University to cure my GI issues after spending years and tons of money to no avail. I changed my lifestyle and found I am sensitive to wheat. No doctor I paid even mentioned it. I now grow the vegetables I eat, do not eat any grains, and buy from local cattle ranchers. I am considered elderly and healthcare is a joke. I remember when it was good. People complain to politicians about the insurance companies, remove federal-funded Obamacare, get the SAD diet reformed. I hate complaining without action.
A Freducum 2481 wrote,
Not sure how he is doing it, but my doctor comes into the room, asks how I am doing, checks my BP. We talk, and then I go home. There are no forms, not that I see.
A hit_W_truth wrote,
Retired RN. As with any realm or profession, the individual is responsible for themselves. A doctor is for consultation and guidance. Ultimately, you are only important to yourselves. The pain management realm is a shit show, especially related to backs. I had a 100K surgery that did nothing to improve my pain or functioning. I was told I needed a spinal fusion, several lumbars, by 3 surgeons. I did not. Had I gone with that, my functioning would have gone backwards. And God help you if you go to a doc about pain. I had been following a new drug, Journavex, for sciatic nerve pain. Absolute miracle, on 1 pill a day. It works directly on peripheral nerves, no brain impairment. Unfortunately, it's only approved for short-term use. I've been on it for 4 months. I couldn't sit for more than 10 minutes before. Now I work 8 hours, mostly sitting. Thank God my doctor just does what I ask. He didn't look it up, just gave me a year's RX.
At Teresa Henley 5659 wrote,
Push back, question, and if you don't improve, walk away. In 2021, I moved out of state, so I had to find new doctors. I went in for a simple recheck of my BP and medication refill, but I spent the first 20 minutes pushing back against being shamed and coerced to capitulate to the C19V. I finally said, look, I didn't come here for this. We will not agree on this topic, so we can move on to the purpose of my visit, or I can leave. I never went back.
Steve U5U5X wrote,
Doctor spends like 10-15 minutes with you, if that. They look at your blood work. Then as soon as they see high cholesterol, they urge statins right away. I'm 62, 6'1", was 235, now 183. Blood pressure is normal. My HbA1c is normal 5 PO. In T4 I eat carnivore keto living since April. So I'm going to ask him to order a calcium scan. I took atorvastatin before, was causing severe cramping in calves and feet. Losing my balance 2-year LDL went down. Since cramping was too much, kicked it aside and went keto, then carnivore, and now just carnivore keto. I eat 175 grams of protein daily. Easy to achieve. 4 to 5 pasture-raised eggs gets 24 to 30 grams. Add aged Parmesan cheese by Regano, and that's another 38 grams of protein. And gets me 88 to 98 grams of protein. 1 cup of plain Greek yogurt gets me 17 grams of protein. I rarely eat veggies. When I do, it's cauliflower and broccoli.
And Mimi Joy M. Forrest wrote,
My son is a clinical informatist at the hospital, and they are trying so hard to assist the physicians in working through all that crap you talked about.
At Andathor 8712 wrote,
What I am hearing more of is Young having his heart problems since COVID, when it was very rare to hear a Young having heart problems before COVID.
At Rufus 80 wrote,
My private practice, DR, retired, and my health/medical records began with her father, who was my DR first. All handwritten notes. My entire chart from dad to daughter was many handwritten files. She was forced to retire due to her building being sold and not feasible to spend the absorbent amount of money it was being sold for. Her father and she was the family DRS for my entire family, grandparents, parents, children, and grandchildren. When she was forced to retire, can you imagine the amount of handwritten records that she had for not just my family, but so very many others? Still to this day, the records are trying to be copied for individuals that need them and want them because she did not sell out to the failing, unsustainable system. I was proud to have a private practice DR who actually knew you as a patient and did take the time and knew when to take more time. It is a failing system. I asked the nurse of my new DR how many patients are scheduled per time slot. The answer was 2 per 15 minutes. How can anyone find out answers about anything in 7.5 minutes to anything, let alone about a human in a medical setting? The medical system is heading for a rock-bottom crash.
At Liz L3D3V wrote,
Please read my primary care office closed down. We're talking about a huge practice, 10 to 12 docs, with each having an enormous amount of patients. I was on life or death medication that I could not just stop. They had one doctor that stayed on until the end of the year, so they closed down in April. I kept calling my office, literally begging for my medication from the remaining doctor in my office, because I love life and didn't want to expire at the hands of their stupidity. Of course, my doctor's nurse stayed on until end of year 2. She was so nice when I first started going there, but turned into Nurse Ratchet. Nurse Ratchet kept telling me I really should try to find a doctor. I informed her that I had already been looking for a new doc a year after going to their office, and there are no doctors. I told Ratchet I would be calling the TV station about my Sturm. Long story short, I told Nurse Ratchet I would be calling the TV station if they don't find me a doctor. Well, less than 5 minutes after I told my office what I was doing, I got a call from a doctor's office who would gladly take me on as a patient. I had called that office numerous times to get in as they were close to my house. Each time I was told no one in their office is taking new patients. A win for the patient. Or was my old office afraid of having their hanky-panky exposed on the evening news? Food for thought.
At Graham Archer 2597 wrote,
Let common sense guide you. We all have it, but let a doctor who hardly ever mentions nutrition give YOU boxes of pills/jibby jabs to cure you. Lunacy abounds.
At Elisata Laurenti 2516 wrote,
The medical system here was great until 2010, when the Obamacare schemes were shoveled over top of it. Then, in 2020, they all took their masks off, and now we see what they are. I haven't had ANY medical care in years, and I'm a disabled senior. I've now banned that entire industry. No more pharma, period. I will never trust them again.
At Corinth the Beekeeper 5442 wrote,
Health insurance needs to go back to the way it used to be. Kind of like our house insurance. You pay for the broken windows and minor things yourself, but you only have insurance to pay for catastrophic things like fire and flood. It's absolutely ridiculous. That office calls are $250 plus for 7 minutes.
The Poet Maggie 1 wrote,
Why save the present medical system? It is so full of errors that it needs to collapse. It will not change the errors, and they are acting like typical witch doctor. They have the only answer.
And Brenda Gilbert RN wrote,
I've been an RN since 1987. I've went through the various decades of the medical system and really started questioning things for the last 24 to 25 years. My eyes were opened up, and it was a painful process. Unfortunately, it wasn't before I had all 4 of my children fully vaccinated. If I had to do it all over again, I would never allow this to happen to my children. I've seen their health suffer from all the vaccinations plus the GMO foods that started in the 90s. I was vaccinated heavily as a very small child, especially at age 2, since my father was in the Army, and we all were required to get everything plus the exotic vaccines since we were stationed with him overseas. I feel that I've acquired numerous autoimmune diseases from the vaccinations. I started studying more holistic practices for health instead of just treating the symptoms with pharmaceuticals. I've witnessed countless lazy nurses doing the least they can do for their patients. Physicians asking me for a full report on their patients in ICU, and then they chart my assessment as theirs. I worked in an emergency room once for 2 years. I was wondering how on earth can anyone get done with not only updating a person's 15-page med list, but all the screenings about everything under the sun? I finally figured out that a lot of nurses just answer the questions in the screenings themselves without patient input because it takes too long, especially when you need to document your physical assessment and chart narrative notes. They just flat out lie since, as you know, everything is timed in the ER, and you better meet all of those metrics or else. Another thing that's ruined healthcare is those flipping surveys. Those were GOD in the ER. Your performance evaluations were also heavily based on them. So those that lie to chart faster serve their patients those turkey sandwich lunches and please their patients with their every whim can score the highest. Insurance companies have ruined the system. They dictate how your doctor can treat you. They control the excruciating cost of medical care. The worst thing that ever passed in America was Obamacare. I could have solved that problem much simpler without a 2,000-page bill that you had to pass to find out what was in it. Now premiums are ridiculous. Your deductible is ridiculous, and your maximum out-of-pocket is ridiculous. How can a person making an average wage of $40,000, $60,000/year expect to make all the premium payments and pay their deductible and sometimes up to a $20,000 maximum out-of-pocket in a year if they had something terrible happen? That's 1/3 to half of their income before taxes. That's one reason why people are broke. It's a tool that destroys your wealth. It's like anything the government or big business touches. It destroys the thing and causes the price tag to go up, like the broke post office increased stamp and postage costs and slower delivery. Or like government-backed student loans with unaffordable college costs that strap one for decades trying to pay them off. Colleges increased all of their costs because why not? The government will guarantee that they get paid. In the last several months, I've had a visit with my OB/GYN nurse practitioner and read her note through my chart, and was extremely disappointed when conditions/issues like my chronic constipation wasn't documented, once again charted no constipation, among other things. Also charted a full head-to-toe exam when it was a focused exam. I also had a visit with my endocrinologist for my Hashimoto's, and gave her a recent list of my meds. She glanced at it. Reading her note in my chart, didn't have my med list updated. Problems/issues I have been having weren't charted.
etc. She also charted a full head-to-toe exam when she barely did a focused exam. She charted educational pieces when there was no education. I had a visit with my rheumatologist, and the nurse who took me back and in whom I gave my med list did not enter them into the system. He, on the other hand, is extremely thorough, which is refreshing. But I've read doctors' notes for decades and have found that they are usually very inaccurate in their charting. This lack of thoroughness can really work against the patient when other providers read it. Their problems aren't documented. This could be a huge issue if anyone needed to go on disability or get treatment and/or surgery from another provider. Prevention is the best medicine. Eat clean food, drink good water free of fluoride, etc. Breathe fresh air. Get out in the sunlight. Acclimate to the weather. Grow your own food. Exercise. Walking is an excellent exercise. Ground with nature. No vaccines. Medical and/or surgical interventions only when necessary. Detox from heavy metals and parasites. Guard your gut health. Thank you all for bringing these issues with our healthcare system to the public.
At Afishin 2ND wrote,
The DMS has replaced what was known as healthcare. A patient cured is a dollar lost. Today's DRs are not allowed to seek out the root cause of disease and are bound by a standard of care policy or lose their license. As a person who follows a carnivore lifestyle and have personally seen in myself conditions that mainstream medicine says cannot be cured with lifestyle/food, not to mention the number of testimonies from other carnivores who heal from many incurable diseases. Look into it.
At Eric Hodges 2471 wrote,
April and SWV ever watch Doc Hollywood? When the Michael J. Fox character is working off his debt and subbing for the country doctor in a rural community, parents bring a small boy in complaining with stomach pain. Immediately Doc Hollywood want to prep him for exploratory surgery. The old county doc walks and pops the top off a can of soda. The little boy takes a drink, burps, and is healed. This is our healthcare system.
At Raymond Day wrote,
I remember getting a checkup before I started to eat healthy and my cholesterol was 201 and the doctor wanted me to take some pill. I just said I had to take pills and never did. Got cholesterol tested again about 2 months ago and I was at 191. No drugs, just eating better. I don't eat any bread or posto or seed oils or high fructose corn syrup. Lost a lot of pounds. Almost 65 years old today too and feel good and healthy. Take vitamin D from Dr. Berg and a vitamin C pill from him too. That's all the vitamins I take 1 time a day. I have been taking 10,000 UI of vitamin D day for years now.
Approve Morong 5183 wrote,
Is there any difference between Walmart and a hospital system? No, they're both corporations. Hospitals died a long time ago. Now they're just your medical Walmart that have shareholders.
As Free 322 wrote,
Every time I've read my chart after a visit, there is always at least one action listed that never actually happened. Or a complaint will be listed that I never made. It's ridiculous.
A Clover Mark 39 wrote,
There is no relevant family history. My mom has asthma from smoking, but from her parents smoking. She never smoked. They ask if relatives had heart attacks or heart problems, but never ask further questions if the smoked etc. Most cases family history is not there or that could be relevant.
And Max's mom BV6HF wrote,
I don't think it is fair to lay the blame at the medical system's feet. Our society has become lazy and dependent on taking a pill for whatever ails them. Out of the 3 of you, do any of you support the low-carb, high-protein lifestyle?
At Wiltempt 1 wrote,
Your need of the population is not more healthcare, it is instead to learn how to take care of themselves. How to know their body, how to study physiology, how to pay attention to their lifestyle, how to change their bad habit. Stop drinking, stop smoking, stop eating crappy food, and start doing exercise. None of these things belong in the camp of the medical system of hospitals, doctor, consultations, interventions, procedures, or surgery.
At Petromas 8574 wrote,
Be careful with AI. It will give the answers that are found most often in the data collection. But this data is often stuffed with corrupted data, paid for by pharma. So it may tell you to get a pill where a lifestyle change is fat better for you.
At Robin Cook 5999 wrote,
We are living in the corporatist state. Mussolini described fascism. Fascism should more appropriately be called corporatism, the merger of government and corporations. It's much more profitable to tap into the tax system than manufacturing cars or tractors. Lobbying people directly to government down the food chain to mangers and doctors, the system needs fuel, the fuel is patience. COVID wiped out a lot of old people vulnerable. I think that there is a shortage of patience, and so they look for problems. Once you meet a doctor, you become their property. I worked it out. There was 10 people who could prescribe and alter my medication. Keep fit will be a disaster for the overlords.
At Stacy and Morgan 6685 wrote,
I stay healthy so I can stay away from these doctors. I live in Canada, and we have free healthcare thanks to our taxes, and it's horrible. Seems like both system not working. Only thing working is you taking our health in your hand. Stay away from processed food. Eat good, move and live.
At Porcus Nature wrote,
History about these systems and when they began can be found at Relocalization YouTube channel. The systems were built up for its purpose. Now they are done with them and us. I began collecting herbal remedies on PDF and using self-help websites like Earth Clinic, where people can post their remedy successes. You save yourself, at least best you can.
At CCC 56 CCC wrote,
Insurance companies are greedy who need to be put in their place. We pay for the coverage, and they want to dictate to the doctors and hospital what they can do. I pay over $900 PO in T00 a month for Cobra insurance through Anthem BCBS, just for my coverage alone. Then you have to pay your co-pays and medicines plus your out-of-pocket, which mine is $6,000 PO in T00. You can't win. The insurance in most cases comes out on top and make billions of dollars a year. Nobody will do nothing about it. Satan is in this world, and he is certainly leading the medical system.
At David Phillips H2R wrote,
Former RN with 15 years of experience in multiple fields. I figured out within my first few years that the rhetoric that is used to get people to go into nursing does not match the reality once the nurse graduates and actually begins working as a nurse. Along with that, I realized it's all about the money. The American healthcare system is a business, and just like any other business, the most important thing is the bottom line. But the added problem with our healthcare system is you not only have the corporate greed, but you also have the bloated inefficiency of a government body. I wound up leaving nursing 4 years ago when I was confronted with the straw that broke the camel's back, which of course were certain mandates that all medical staff had forced on them or lose their jobs.
At Valkanier wrote,
This is absolutely what Obamacare was designed to do. The entire purpose was to collapse the system to force a single payer plan. Anyone who thinks otherwise did not listen to Obama's own words. Obama said everyone would eventually be forced to go single payer. He 100% designed a system where corporate greed would collapse the entire thing and force government control.
At Backroads 82 wrote,
Other than for an emergency like a car accident or something like that, I would rather distance myself from doctors and hospitals. I haven't been to a doctor in over 30 years. I am 61 now and will do what I need to do to take care of myself. I have seen firsthand what happens to lots of people that get caught up in the healthcare system. The internet is full of good information that we can use to take care of the majority of our health issues. We just have to do our own research and find the good, reliable sites that provide the information we need. It is out there, and we won't get cut short on time to get that information like we would with a doctor's office visit.
At Inge Nielsen 1724 wrote,
These are exactly the same problems we have here in Denmark. I have pretty good health myself, but I really feel sorry for those who need to be seen by a doctor. It will take a LOT before I see a doctor again. My trust in the system has slowly disappeared, and has completely disappeared within the last 4 to 5 years. Overst en samtale.
At Selenian 0255 wrote,
My brother-in-law has a large mass on one of his lungs. He has a CT scan and to see a lung specialist. Praying it's not cancer. I have been aware of the medical system and am worried about the care he will get. Natural care and other alternatives may be his best bet. Ever since the jabs, his health has been greatly impacted. He is just 71. We do need good doctors, nurses, and other medical professionals.
At JP6993 wrote,
Don't use insurance. I pay cash and get the care I pay YFOR and GET Excellent Care. There is NOLAW that says you have to use insurance. Insurance companies can kiss my rear. NOONE is ever going to tell me what doctor to see, and to hell with their referrals for care. Such BS. I go to a clinic, doc in a box, or EMR if I need care.
At Not Their Brother wrote,
You are the doctors. You have the expertise. The entire industry depends upon your work. You have allowed this to happen. Doctors need to organize, get together, and act together. Everybody for themselves isn't working without you. The insurance systems can't survive. Start telling them how it's going to be.
At Betty Russo 5410 wrote,
I am a 30-year L&D NICU PEDS ER retired nurse. I watched the USA go from excellent world-renowned care to the worst care in many ways, below some third world countries. The rise of technology has led to the demise of healthcare in many ways. Telehealth is extremely dangerous. How many cancers have been missed because a generation of doctors and patients prefer to look at a screen rather than go in person? Because it is easier. How many tumors, heart failure, arrhythmias, heart murmurs, pneumonias, bacterial infections, ear and sinus infections have been missed because they have never actually been examined by a doctor, never had physical eyes and hands, or a stethoscope placed on their body? By the time the patient is forced to go to a hospital, they are too far gone, and the staff doesn't care. The medical machine has joined with Big Pharma, and we all lose. The most horrific element of healthcare is our health being dictated and run by the government, and the elderly pay the dearest of them all. This country discards and disrespects its elders more than any other country on earth, and they become a burden in society that is forgotten as soon as possible. I am deeply afraid to go to a hospital because I know how dangerous it is. The care a person receives is directly dependent on the moral and ethical beliefs of the caregiver.
At QQ the Light wrote,
Thank you. I had to experience the healthcare system at an early age, so I have seen the changes happen. It's comforting to hear my concerns be put into words and knowing someone cares. I've had to take my own health into my own hands and feel an accomplishment in doing so. I has helped a great deal. I'm 74. Our children have adopted alternative healthcare for themselves and their families.
At Ellen Kehoe 208 wrote,
I totally agree with you three doctors. Our health is in our own hands. I can't remember when I was last on medication, but my doctor told me to go on statins, but all I needed was a change of diet. I am 72 doing all the right things and following Barbara O'Neill and one or two others. Getting fantastic advice. And of course, you three lovely doctors are super too.
At Mary Magnuson 5191 wrote,
Need to go back to just having major medical insurance for major problems. DRS need to be in private practice, pay as you go. All medications that are OTC in other countries should be everywhere.
At J. Lancaster 5506 wrote,
I absolutely deep dive JAMA. Abstracts Etsy for information on best practice for people my age 76. I have found the information actually sometime less militant about things like statins and high-powered antibiotics Cipro, Macrobit Etsy for people over 75. I find normal ranges for people my age a bit more forgiving and more flexibility on imaging tests, colonoscopy, etc. at 76 110-80/20 nutrition, no processed, fast foods. Sodas, toxic oils, cook my own food, okay. Sweet, do most of my own housework and love my patio garden. I have very bad white coat BP. 170/90 in office. 115 to 120/75/80 at home on home monitor. My physician refuses to enter my home readings and my yearly wellness even when I take my actual monitor in for her to calibrate. I get lectured that my BP should not be over 120/70. I feel absolutely fine. My triglycerides were 210 and statins were recommended. A mild UTI with threshold leukocytes and only mild discomfort and urgency. Macrobid was insisted on at least a 3-day trial before she would consider a different antibiotic that I know I tolerate as I have antibiotic sensitivities. I had a horrible vertigo, tinnitus, dizziness, nausea, and palpitations on second 200 milligrams/2 per each 24 hours. Never so sick and scared in my life. I was encouraged to finish the 5-day script unless response worsened, as Macrobid is the first-line antibiotic for UTI and sepsis is a very real possibility and often fatal in people my age. I had no temp, no chills, no weakness. I did not take another dose, purchased a home strip test, employed home care, and within 5 days no detectable leukocytes, no nitrates, maintained slightly acidic pH. Absolutely no symptoms. But completely scared I might develop sepsis and die. AI told me. Mild leukocyte, non-symptomatic UTI in women my age warrant symptom management and not antibiotics unless in nursing home. I would give anything for a PC who was geriatric specific. At 76, feel that my remaining years are bonus years to enjoy my grandchildren, family, and friends. I don't want tests, unnecessary medications, or interventions. I do not a longer life at the expense of living my life. I beat stage 1 breast cancer with bilateral mastectomy, no reconstruction, no chemo, no radiation, and no tamoxifen. 20 years ago. I love every word spoken in your panel videos, and your voices of reason give me confidence in seeking and requesting care should I need it based on my individual profile and wishes.
At Lynette Hardy 8653 wrote,
I firmly believe that what is going on in the world, not just with the medical profession, but with governments, industry, chemicals in our environment, and our food, is one big evil plan with hundreds of arms. And that is to control us and ultimately reduce and remove us. By us, I mean ordinary citizens. They don't want to share this planet with us. I'm a 73-year-old British man and have open eyes.
At Susan Lemon 7297 wrote,
Option Care out of Ohio charged me $441 for a bag of Salone. Even same is listed on Amazon Go $13. How can they get away with that?
At Adge Clark 538 wrote,
Many years ago, a Scottish health economist said that privatization would cost us more money. They want to make a profit and their shareholders want a bigger dividend. There is nothing wrong with the NHS ideology. It's the most cost-efficient way to give healthcare to society. It's the management of the NHS that's at fault, political interference, and the greed of money of the private health industry.
Adelacrene 3296 wrote,
A lot of mention of insurance companies, but nothing about big pharma. Apart from a mention that doctors are offered and accept incentives to prescribe meds. They see them as two cheeks of the same bum.
At Rondell 1 wrote,
Hello. First of all, thank you to all of you. I appreciate your honesty, agree with you about what is happening to the medical system. It is sad and must be very disappointing and a kind of a betrayal to doctors, after having spent many years studying to become doctors in order to help people. Yes, it seems to be all about profits these days, I agree. I work at a medical practice, and I really do not like it when I see these drug reps coming to the clinic, feeding doctors lunch in order to try to push new drugs or money-making schemes onto them and their patients. It's really bad. The doctor's appointments are now so short that the nurses are increasingly doing more of the work that doctors used to do once. The nurses are performing more assessments, asking the screening questions, getting to know what their needs are, what is due for the patient. Then they will see the doctor for about 5 minutes following this to have it checked and signed off. Perhaps a script will be issued, perhaps a referral will be made, a result may be checked, but that is about all time allows a lot of the time. The doctors seem to be like a middleman, traffic controller for everyone else. Sign this and move on, used by drug companies and specialist services and government departments. Their job would be quite unrewarding due to all of this, I would expect. I would rather spend the time with the patient and be doing the hands-on tasks for the patients if I were a doctor.
Adancitil Dawn 484 wrote,
It's the United Corporations of America, and it's been like that for a really long time. I'm sick to death of hearing that we are the richest country, and yet majority of people are struggling, don't have health care, don't have nationalized child care, don't have anything of the other developed countries have. It's on adulterated, unconscionable pursuit of greed by people who are already upseeing wealthy. I'm a rideshare driver and the CEO of Lyft makes 78 million, and yet they've cut the driver's percentages almost in half, sometimes 40%, the other 60%, 65% is going to the company I've been driving for 5 years. And I can't pay my bills anymore, home insurance, car insurance, and the taxes to internet utilities.
At Brett Atkinson 4325 wrote,
Thanks, doctors. I wish there were more like you in these very challenging times. This is a controlled demolition of our sacred NHS to bring in who knows.
Ishnooz 1 wrote,
I'm a 78-year-old disabled woman. I haven't seen a doctor in years. Luckily, even though I need a cane to get around, I stay fairly healthy, and the only issue I have is that I have no idea what is going on with my health. The last time I tried to see a doctor, I contacted a huge medical center/hospital in Palm Springs to try to get an appointment with a primary doc. I was told there was a 700-person waiting list. So, I don't see a doctor.
At Mabelheinsel 2275 wrote,
I live in one of the richest countries but it's failing here too. Not enough doctors, overloaded, retiring early. We have controlled borders, so I don't think too many patients like Britain, for example.
The Fifth Danu 219 wrote,
Thank you, doctors. I'm living in Hungary now, and in many conversations I shared the following. Once upon a time, the USA had the best medical professionals and wonderful private and ethical medical practices. I, for one, mourn their demise, and I'll never have the privilege to see their rise again. You three represent a minority, as I represent another group 60 plus on no meds. God bless you.
At James Keys 971 wrote,
What if med students could graduate without debt? The profit motive is a good thing, but it seems to be that making money off the suffering of others is obscene. It seems to me that tuition-free medical school along with a stipend for living expenses would be a good thing.
At Grazioso 58 wrote,
I tell you, it is impossible to not to go the doctor when you are T1D. I wish it was there is no option for decent basal insulin beside Walmart NPH, which is like okay in a pinch, but geez, that is not much choice.
At GracieHYS2 IQ wrote,
I think governments thought it was a great idea to let big pharma take over medical research, but it has cost us dearly. We have gone from healing patients to just treating symptoms.
At GracieHYS2 IQ wrote,
I was diagnosed with ADHD at 52 and unpicked the nonsense genetic hypothesis. We are drugging and disempowering vulnerable children. It is utterly criminal. Millions of people are not suddenly being born dopamine deficient. It led me to write ADHD Nature or Nurture.
At Hardfacts 181 wrote,
The hierarchy in hospitals and layers of new positions have to justify their increased salaries, and they come up with new ideas that the nurses and doctors on the floor have to implement. The more bureaucratic elements, the worse it's got each time.
At Kristen Haynes 407 wrote,
Yes, I agree. We have to ourselves focus on doing what we can to protect our own health. No excuses indeed, but I would say it is tougher for people on low incomes. They cannot afford to buy better food. They spend their days worrying about how they're going to afford to keep warm this winter, washing clothes by hand because they can't afford to buy a new washing machine, doing all the jobs themselves, trying to fix their car, fix their computer, fix a plumbing problem, etc., because they can't afford to pay contractors. Thus, those on low incomes are worn out and have little time and energy left to focus so much on their health. We need a revolution. We get used, abused, and exploited by corporate companies. The workers make them rich and get little in return, not even essentials such as healthcare. The public tend to put up and shut up. Nothing will improve unless the public are better informed. We have the ridiculous situation in the UK where the public are misled to blame migrants/immigrants for long NHS waiting lists. Of course, migrants/immigrants are not to blame. Government policies and underfunding of the NHS are to blame. Thank you to these three doctors for seeing things from the patient's point of view.
At Enid Cronin 9704 wrote,
With everything becoming digital, will the system collapse if the lights go out? In my mind, the reliance on computers means we have limited backup strategies. A pen and paper may be old-fashioned, but reliable.
At Charlie Pierce 8767 wrote,
I'm an Aussie living in Australia. My new DR just migrated from the UK. He filled me in on how the medical systems in the UK is trashed. Sounds horrible.
At Jerry to C9Z3E wrote,
My physician that I have been going to for 40 years passed away 5 years ago. Since then, I have switched doctors 4 times due to poor service/treatment.